Welcome to the deep dive. Today we're getting into a topic that likely affects way more of us than we think. Insulin resistance. We've gone through the sources you sent, mainly Benjamin Bikman's Why We Get Sick. It really argues that insulin resistance is like a root cause for a lot of chronic diseases.
Exactly. And our goal here is to make it clear, cut through the noise,
Right. Give you a solid grasp of what it is, why it's such a big deal, and crucially, what you can actually do about it.
Consider this your shortcut to understanding something really fundamental to your health. The material really paints a picture of how this one thing connects to so many different health problems.
Problems that seem unrelated on the surface.
Totally. So we want to connect those dots for you, pull out the info that empowers you.
And for you listening, wanting to get up to speed quickly, make those connections for your own health. This is definitely for you. We're pulling out the key stuff.
Hopefully I'll have a few aha moments along the way.
Yeah, exactly. And leave feeling more clued in, maybe more in control. Okay, so let's unpack it. What is insulin resistance really?
Well, first off, it's surprisingly common. The data suggests it could be like up to 88% of adults in the US might have it to some degree.
88%. Wow.
Yeah. And it's not just a US thing, it's global. It's doubled in the last 30 years, and they expect it to double again soon.
That's huge.
And what's interesting is how we usually focus on blood sugar, right? Blood glucose.
Right, that's the main number you hear about with diabetes.
Exactly. But while high glucose is a sign of diabetes, insulin resistance itself is more about having higher insulin levels than you'd expect for your glucose level.
Ah, okay. So the insulin itself is high, even if the sugar isn't quite in the diabetic range yet.
Precisely. Glucose is often treated as the main villain, but Bikman argues insulin is the real driver, the key player behind the scenes.
Insulin as the director, not just an actor. I like that.
It's a good way to think about it, and it helps understand type 2 diabetes better. It's not some separate disease that just pops up.
So what is it then?
The source is clear. Type 2 diabetes is insulin resistance. It's just insulin resistance that's progressed to the point where your fasting blood glucose is consistently over 126 mg/dL.
So it's a continuum.
Exactly. The author even suggests we could often substitute insulin resistance for type 2 diabetes to be more accurate about the underlying problem.
Okay, that's a really useful reframing. So if it's this common, this fundamental, how does it cause so many different problems? Let's start with the heart. Big area of concern for many people.
Oh, the link there is incredibly strong. The source basically says insulin resistance and cardiovascular disorders are, well, almost inseparable.
Inseparable. How so? Like high blood pressure?
Definitely hypertension, yeah. High insulin levels directly contribute to high blood pressure. There are a couple of ways.
Okay, how does that mechanism work?
Well, one key player is a hormone called aldosterone. Insulin actually tells your body to make more aldosterone.
Aldosterone. That affects salt balance, right?
Exactly. More aldosterone means your kidneys hang on to more salt, and water follows salt, so your blood volume goes up.
And more volume means more pressure in the pikes, basically.
You got it. And interestingly, the source points out that because carbs spike insulin more than fats do, they can actually have a bigger impact on blood pressure than dietary fat.
Huh. So controlling insulin might be as important, or maybe even more important, than just watching salt intake for blood pressure.
It suggests that, yeah, it's not just the salt shaker.
Okay, what else?
High insulin also signals the cells lining your blood vessels, the endothelial cells, to grow. Insulin is a growth hormone after all.
So the vessel walls actually get thicker.
Yeah, they thicken up, which narrows the space inside the vessel, another hit for blood pressure and flow.
Wow, okay. Double trouble there. What about cholesterol? The lipids in our blood?
Yep, insulin resistance messes with that too. It's called dyslipidemia. Specifically, high insulin pushes the liver to produce more of a nasty type of LDL cholesterol.
Nasty type. I thought LDL was just LDL.
Well, there are different kinds. Insulin promotes what's called LDL pattern B. These are smaller, denser LDL particles.
And why are they worse?
They're more likely to wiggle into the artery walls and start forming plaque, atherosclerosis.
Ah, okay. Can you see that on a standard test?
Not directly the pattern B usually, but high triglycerides and low HDL cholesterol are often clues that you might have more of this pattern B LDL. They're like red flags for insulin resistance driving this unhealthy lipid profile.
Good to know. High triglycerides, low HDL, potential warning sign. And I think the sources mentioned inflammation too.
Absolutely. Inflammation is a huge part of it. Normally, insulin can actually be anti-inflammatory, but when you're insulin resistant, the high levels of insulin flip and actually promote inflammation.
So it backfires.
Kind of, yeah.
Mm.
It contributes to those atherosclerotic plaques by boosting blood pressure, helping lipids deposit in the vessel walls, and calling in inflammatory immune cells, macrophages.
So it's like creating the perfect storm for heart disease, high pressure, sticky fats, inflammation.
Exactly. It really sets the stage.
And did the sources mention cardiomyopathy, issues with the heart muscle itself?
Yes, specifically dilated cardiomyopathy, where the heart gets enlarged and weak.
Hmm.
The thinking is the heart muscle needs glucose for energy, right?
Mm-hmm.
But if the heart cells become insulin resistant, they can't take up and use glucose properly. This could lead to an energy shortage in the heart muscle, weakening it over time.
Man, the reach of this is just incredible. Okay, let's shift gears. The brain. That was another big one in the sources. Alzheimer's especially.
Yeah, the connection is so strong it's sometimes called type 3 diabetes.
Type 3 diabetes. Wow.
Initially, people thought maybe it was just that Alzheimer's patients were less active, leading to insulin resistance.
Nice. Sedentary lifestyle.
But newer research shows insulin resistance is there even early on, even in people who are just as active as healthy folks. That points to a more direct link.
So it's not just a consequence, it might be part of the cause.
It really looks that way. Healthy insulin signaling seems critical for the brain.
And what about other types of dementia, like vascular dementia?
Also strongly linked. Vascular dementia comes from poor blood flow to the brain. And given what we just talked about with insulin resistance damaging blood vessels.
It makes sense it would affect the brain's blood supply too.
Exactly. One long-term study found people with insulin resistance had roughly double the risk of developing vascular dementia. Same vessel problems, different organ.
And neuropathy, nerve damage, often blamed on high sugar.
Right. But the sources argue insulin resistance itself plays a role. Nerves need insulin to work properly to manage their energy. If they become resistant, their function suffers, even before blood sugar gets sky high.
So again, it's the insulin signaling itself that's crucial. Okay, this is really broadening the picture. Let's move to reproductive health. Insulin impacts that too.
Oh, absolutely. The sources stress that both too little insulin and too much, like you see with the high insulin of insulin resistance, can mess with fertility for men and women, and even puberty timing in kids.
Okay, let's take women first. How does it play out?
Well, pregnancy is a good example. You actually need good insulin sensitivity for healthy placental and breast tissue development.
Right.
But insulin resistance during pregnancy is linked to complications like preeclampsia, that dangerous high blood pressure condition. It seems tied to the blood pressure effects of insulin resistance and how the placenta reacts.
Okay. And the baby's weight.
Yeah, maternal insulin resistance really influences that. The Dutch famine study was mentioned, fascinating stuff.
What did that show?
It showed that babies whose mothers experienced famine early in pregnancy were more likely to become obese later in life, regardless of their birth weight. It suggests the womb environment programs metabolism long term.
Wow. So it's not just about being born big or small.
Right. And paradoxically, while being a big baby raises risk, being a low birth weight baby seems to carry an even greater risk for obesity and insulin resistance later on.
That is completely counterintuitive.
It really is. Shows how complex the body's adaptations are. Then there's PCOS, polycystic ovarian syndrome.
Yeah, very common.
The source basically says PCOS at its core is a state of too much insulin. That excess insulin throws hormones out of whack.
How?
It can inhibit an enzyme called aromatase. Aromatase normally converts androgens, like testosterone, into estrogen. So if it's inhibited...
You get lower estrogen and higher androgens,
Ah.
leading to symptoms like excess hair growth.
Exactly. Plus, high insulin might directly mess with LH, a key hormone for ovulation. And those dark skin patches, acanthosis nigricans, that's often a sign of high insulin too.
So the insulin imbalance is really central to PCOS. What about men's reproductive health?
For men, insulin resistance is linked to things like lower sperm counts, poorer sperm quality, and also erectile dysfunction.
Okay. And hormones.
Yeah, it's associated with lower testosterone levels too.
So it packs across the board there. And for kids, you mentioned puberty.
Right. Body fat influences when puberty starts, and higher BMI often means earlier puberty. The idea is that excess insulin drives up another hormone, leptin, and this combo contributes to hitting puberty sooner.
It's sobering how this one thing ripples out. Okay, let's tackle another heavy hitter, cancer. What's the connection there?
It's definitely a concern. The source states people with hyperinsulinemia, high insulin, have roughly double the chance of dying from cancer overall.
Double. regardless of weight.
Regardless of weight, yeah.
Yeah.
And the link seems even stronger for certain cancers. Breast, prostate, colorectal.
Okay, let's break those down. Breast cancer.
Women with higher fasting insulin levels tend to have worse outcomes. And remember, insulin is a growth signal.
Right.
Well, breast cancer tumors apparently have way more insulin receptors, like 6 times more than normal breast tissue, makes them super responsive to insulin telling them to grow.
Yikes. It's a very direct mechanism. Prostate cancer.
Also strongly linked. The prostate is sensitive to hormones, including insulin. And even before cancer, there's BPH, benign prostatic hyperplasia, the enlarged prostate common in older men.
Causes urinary issues.
Right. Men with insulin resistance are 2 to 3 times more likely to get BPH. Again, suggesting insulin is driving growth there.
Same theme, unwanted growth. And colorectal cancer.
Similar idea. High insulin can increase the number of cells lining the intestines. More cells, more cell division, potentially increases the risk of something going wrong, leading to cancer over time.
Okay, so this growth-promoting aspect of insulin really seems key when it's out of balance. Now, aging. Does insulin sensitivity play a role in how long or how well we live?
The sources suggest it absolutely does. It's fascinating. The longest living people tend to be the most insulin sensitive.
Really? Even accounting for other factors?
Yeah, even considering things like body mass, sex, plus certain gene variations related to insulin are linked to longevity. And there's research into whether insulin sensitizing drugs might actually slow aging.
Wow. So keeping insulin sensitive isn't just about preventing disease now, it might be tied to lifespan itself.
It seems to be a really significant factor, and many things we think of as just normal aging, skin changes, losing muscle, bone loss, are actually linked to insulin resistance.
Like sarcopenia, muscle loss.
Yeah, exactly. Muscle is your bigger insulin-sensitive tissue. Insulin normally helps build and maintain it. When you're resistant, muscle doesn't respond as well, and you get more muscle breakdown. Makes it harder to stay strong as you age.
And bones. I thought maybe being heavier with insulin resistance might protect bones.
It's tricky. You might have higher bone mass, maybe partly from the weight, but the bone strength or quality can be lower, so increased fracture risk. And insulin resistance in teens has even been linked to poorer bone development in boys.
So density isn't the whole story. Quality matters too. What about joints? Arthritis.
High insulin can fuel inflammation in the joints, and it might also reduce synovial fluid, the joint lubricant. That could contribute to osteoarthritis.
Makes sense.
And conditions like rheumatoid arthritis, which are already inflammatory, actually increase your risk of becoming insulin resistant. It can be a vicious cycle.
Inflammation driving insulin resistance and vice versa. And gout? How does that fit in?
Gout is caused by uric acid crystals building up in joints. Insulin resistance messes with how well your kidneys get rid of uric acid.
So the kidneys can't clear it properly, it builds up.
And deposits in the joints, causing that awful pain.
Yeah, man, it just keeps going. Okay, let's look at the systems that handle nutrients directly: digestive, urinary, liver, gallbladder, kidneys.
Right, these are obviously central to glucose control. The liver, for example. When it's insulin resistant, it doesn't store glucose as glycogen properly.
So glucose stays in the blood.
Worse, the resistant liver might even start making more glucose and releasing it, even when blood sugar and insulin are already high. It fuels the fire.
And this is where fatty liver disease comes in. NAFLD.
Exactly. Non-alcoholic fatty liver disease. Huge link to insulin resistance. The source really points a finger at fructose, especially from things like fruit juice, driving visceral fat gain, which then contributes massively to NAFLD.
What used to be rare is now super common.
Yeah, most common liver disorder in the West now. It's a stark example of diet's impact.
What about the gallbladder and kidneys?
Insulin actually slows down the gallbladder's contractions, which can increase the risk of gallstones forming.
And didn't the source say something about low-fat diets?
Yeah, interestingly, it mentions that very low-fat, low-calorie diets can also increase gallstone risk, maybe by not stimulating the gallbladder enough. And the kidneys, well, we mentioned uric acid already, they just need proper insulin signaling to function well overall.
Okay, so systems everywhere are affected. Now, the big one everyone associates with this, obesity. What's the relationship according to the sources? Chicken or egg?
It's definitely presented as complex, often a chicken and egg thing, but the source strongly pushes back against the simple calories in, calories out idea.
Right, it says hormones are key, insulin especially.
Precisely. Insulin is the fat storage hormone. It tells your body to store nutrients as fat. The source argues that high insulin can make you gain fat even if your calories stay the same.
So the type of calories matters because of the hormonal response.
That's the argument. A 2,500 calorie diet that keeps insulin low could lead to less fat storage than a 2,500 calorie diet that spikes insulin all the time.
That really flips the script from just calorie counting. Okay, we know diet and exercise are huge causes, but what else contributes to developing insulin resistance?
Well, age and genetics play some role. We tend to get more resistant as we age. And there's the thrifty genotype idea for some populations, like the Pima Indians, a genetic tendency to store energy efficiently, which backfires now.
But lifestyle is bigger.
Lifestyle seems much more dominant than genetics for most people, yeah.
Hmm.
Hormones are another factor. Stress hormones, cortisol, epinephrine, they raise blood sugar and fats and directly cause insulin resistance.
Cortisol, the belly fat hormone.
Exactly. Cortisol particularly drives that visceral fat accumulation. Thyroid hormones matter too, and changes in sex hormones as we age influence sensitivity.
So our internal hormonal mix is really important. What about body fat itself? You mentioned visceral fat.
Right, where you store fat matters hugely. Visceral fat, that deep abdominal fat, the apple shape, is much worse metabolically than subcutaneous fat, the pear-shaped fat under the skin.
Why is visceral fat so bad?
The fat cells themselves, especially when they get large, can become insulin resistant. Things like ceramides and another compound called 4-HNE build up inside them and interfere with insulin signaling.
Chloramides.
Yeah, they're a type of fat molecule. And when fat gets stored in places, it shouldn't be like the liver, pancreas, muscles, that's called ectopic fat, that really messes up insulin action in those organs.
So fat in the wrong places. Got it. Any other surprising causes?
Chronic inflammation is a big one, whatever the source, like autoimmune diseases. And environmental factors, too.
Like what?
Air pollution, believe it or not. Fine particles, PM2.5, seem to trigger inflammation and are linked to insulin resistance and type 2 diabetes. Secondhand smoke, too.
Wow. Air pollution.
Yeah. And some studies link persistent organic pollutants, POPs, to higher risk. Even artificial sweeteners come up.
Artificial sweeteners?
Really? The link is mostly correlational from studies, and the mechanism isn't totally clear, but there's a suggested association with increased risk of insulin resistance and metabolic syndrome. Something to keep an eye on.
Man, it feels like modern life is kind of setting us up for this. Okay, crucial part. Fighting back. Lifestyle seems key. Exercise first.
Huge. Exercise is fantastic. It naturally lowers insulin, makes your cells more sensitive to it often, even if you don't lose weight initially.
How does it help with the causes?
It tackles central obesity, oxidative stress, inflammation, all those things we just talked about.
Aerobic or weights?
Yeah.
Or does it matter?
Both are good. Bikman suggests resistance training might give a slight edge minute for minute, probably because building muscle gives insulin more places to work. But honestly, the best exercise is the one you actually do.
Consistency over perfection. Makes sense. Does intensity play a role?
It seems to, yeah. More vigorous exercise generally leads to bigger improvements in sensitivity, but you got to start where you are, build up gradually.
Right. Don't overdo it at first.
And interestingly, the source mentions cold exposure too. Briefly activating brown fat might help sensitivity by making you burn more glucose and fat.
Cold showers getting trendy for a reason, maybe? Huh. Okay, diet. Big focus in the sources, especially on keeping insulin low.
Absolutely. The book really questions the whole low-fat craze, saying the data behind vilifying fat was shaky.
So fat isn't the enemy?
Not necessarily, especially in the right context. Fiber gets a thumbs up, particularly if you're already resistant. It helps blunt those glucose and insulin spikes after meals.
Okay. What about how often we eat?
That matters too. Things like intermittent fasting or time-restricted eating can be really powerful because they give your insulin levels a chance to actually come down and stay down for a while.
Gives the system a break.
Exactly. Just need to be careful about refeeding properly after longer fasts.
Good point. What about the macros? Carbs, fat, protein?
Well, carbohydrate restriction has a long history in managing diabetes. Low-carb diets consistently show significant drops in insulin and better sensitivity compared to low-fat approaches in studies.
But not all carbs are equal, right?
Definitely not. Focusing on glycemic load, how much a food raises blood sugar, is key, not just total carbs.
And protein. Does that spike insulin?
It can a bit, but the response depends a lot on how many carbs you're eating. If you're low carb, the insulin response to protein is usually pretty minimal because your body might use some for glucose production.
Okay. And fat. What about saturated fat?
The source argues that in the context of a low-carb diet, higher saturated fat intake hasn't shown the negative effects on blood lipids people feared. It might even be better than some unsaturated fats in that specific scenario. The real problem fats seem to be things like ceramides that your body makes when inflamed, not necessarily just dietary saturated fat itself.
Hmm, that's a nuanced take. What about keto diets?
Ketogenic diets are very low carb, pushing your body to burn fat and produce ketones for energy. Ketones themselves might actually help improve insulin sensitivity, but big but high fat diets with high carbs, that's generally unhealthy, the combo matters.
So low carb, high fat seems different metabolically than high carb, high fat. Any specific foods highlighted?
Yeah, fermented foods get a mention things like apple cider vinegar, maybe sourdough bread. They might lower the meal's glucose impact and support gut health.
Interesting. And food quality.
Huge emphasis on whole, unprocessed foods,
Yeah.
being mindful of cooking oils, where your animal products come from, that kind of thing.
Makes sense. Any specific nutrients?
A few are mentioned as potentially playing a role. Magnesium, omega-3s, vitamin D, chromium, lipoic acid, green tea extract, cysteine, things that might support sensitivity.
Okay, so a whole foods approach, smart carb choices, maybe some fermented foods, paying attention to quality. Seems like a solid plan. Now, what if lifestyle isn't quite enough? Medical options.
The source briefly covers some drug classes. There are the SGLT2 inhibitors, gliflozins, that make you pee out extra glucose.
Okay.
Sulfonylureas force more insulin production, but have significant side effects like weight gain. TZDs improve sensitivity, but can cause gut issues. Metformin is common, reduces liver glucose output, modestly improves sensitivity. Main side effect is usually GI upset.
So varying effects and side effects.
Right. And then there's bariatric surgery for significant obesity. Gastric bypass seems to have the most dramatic, immediate effect on insulin sensitivity, often reversing type 2 diabetes very quickly.
Wow, bypass works fast.
Often, yeah. Sleeve gastrectomy is also very effective, maybe fewer complications than bypass. Gastric banding is less effective for insulin sensitivity, but all surgery has risks and potential downsides, physical and psychological.
Right, surgery is a major step. Always needs careful consideration with the doctor. Okay, so putting it all together, what's the action plan from the source?
First, figure out where you stand. The book has a quiz, but ideally, get your fasting insulin measured. That's key.
Not just glucose, but insulin level.
Exactly. Knowing that number tells you a lot. Moderate elevation, say 717 OML range, means changes are warranted. High levels over 18 need immediate action.
Okay, assess first, then exercise.
Yep. Start where you can. Gradually increase frequency or intensity. Focus on compound resistance, move squats, deadlifts, presses, things that work big muscle groups. But really, just be consistent. Don't get intimidated.
Consistency, consistency, and eating.
Prioritize keeping insulin low. Real food first. Limit refined carbs, sugars. Don't fear healthy fats. Get adequate protein. Use glycemic load as a rough guide. Maybe add fermented foods. Think about food prep, sourcing.
Sounds like a sustainable approach.
Yeah.
Any immediate first steps recommended?
2 things. Change your breakfast. Ditch the typical sugary cereal or toast. Go for protein and fat from real foods, eggs, avocado, maybe some nuts, or full-fat yogurt if you tolerate dairy. Start the day without that big insulin spike.
Good practical tip. And the second?
Get your insulin measured. Seriously, it's the most direct way to know your status.
Okay. Assess with an insulin test, start with breakfast, build consistent exercise, focus the diet on real foods that keep insulin low. Got it. This has been, wow, a really comprehensive look. So the main takeaway for everyone listening.
I think it's that insulin resistance is incredibly common, often hiding behind other diagnoses, but crucially, it's not necessarily a life sentence.
There's hope.
Definitely. These lifestyle changes based on the science presented can be incredibly powerful for preventing it, managing it, even potentially reversing it. You really do have a lot of agency here through your daily choices.
That's a great message. You have the power to influence this. Okay, final thought for you to chew on. Considering how insulin resistance connects to so many different conditions, heart, brain, cancer, aging, what's one small manageable change you could make starting today to begin fighting the resistance? Something that might lower your risk across the board. Worth thinking about.
Good question to ponder.
Absolutely. This is just the start, really, of digging deeper into your own health. Thanks for joining us on The Deep Dive.